So treatment of hip arthritis typically starts with what we call conservative management, which would be non-surgical treatment. There are lots of things that we can do when the symptoms of arthritis start to try to help treat the symptoms. What we typically think about are a combination of several factors. So number one, when the joint becomes arthritic, it becomes inflamed, meaning that our body is sending inflammatory cells to that joint, which can cause swelling of the tissue, which causes pain. So we like to look at ways to decrease inflammation in that joint. Some simple ways of doing that are using anti-inflammatory medications, which can range from simple over-the-counter medications to sometimes a prescription strength formulary of the medication. There are also some more natural ways of addressing inflammation, and sometimes that can be taking a closer look at the diet or getting plugged in with a dietitian to try to modify the intake of foods that are pro-inflammatory or foods that increase inflammation. There are also some natural over-the-counter herbal type supplements which can be anti-inflammatory as well. So we try to look at different ways of decreasing inflammation because that can help to address the symptoms. We like to combine that with finding activities that help to strengthen the muscles around the joint and to help to keep the joint strong and flexible. If we can decrease the inflammation and we can increase the strength and range of motion of the joint, then we can oftentimes address the symptoms that the patient is having. And so the ways that we can help with strength and range of motion, that can range from starting a program of hip exercises at home, and sometimes that can be self-directed if the patient is motivated to do something like that. Sometimes that would be more of a group class type session that you can get involved in, or sometimes that would be one-on-one work with a licensed physical therapist. Once we have tried anti-inflammatories and physical therapy, another non-surgical treatment that we can sometimes consider would be an injection. And so we can inject medication into the joint to help with symptoms. The most common thing that we would inject would be a corticosteroid medication. Corticosteroid is a strong anti-inflammatory. So in some ways, it's working similar to the anti-inflammatory that you might take by mouth, but it's a much more targeted administration of that medication in a larger dosage. And so we can inject that into the joint, and it sometimes will provide a very strong anti-inflammatory effect for several months or more, and that may allow a patient to feel more comfortable to participate in physical therapy and exercise and help to keep the symptoms at bay.